We are now taking you live to Darwin now, where Northern Health officials are providing a COVID update. You can see there the Chief Minister, Michael Gunner, is speaking.
Arrival at the airport and was immediately taken to Howes Springs, where he returned a positive PCR test. There were 2,221 tests taken in the territory in the past 24 hours. The close contacts number is 222, all contacted and isolated. Of these, 201 negative tests have been returned. So these results today are pretty standard and pretty expected, but we do still have concerns about Katherine. It's clear that there are a small collection of households in about 3 or 4 adjoining streets in Katherine East that are largely unvaccinated, spend a substantial amount of time together, and are still a high risk. Dr. Heggie can talk about this more, but we've decided this morning to implement a more intense testing effort in these streets in the next few days. A new Chief Health Officer direction will be issued later today that applies only to residents in these streets, nowhere else in Katherine. Then teams will be going door to door in these streets, testing residents and visitors to those streets, so we can be absolutely certain about where the virus is. It will be a legal requirement to get tested. We are being as targeted as we possibly can to catch and kill this virus. Before Dr. Heggie speaks, I will talk through the details on the changes from the 20th. As you know, it's our plan to remove quarantine requirements for fully vaccinated arrivals from 20th of December, and we are sticking to our plan. 7-day home quarantine is going really well. We have 1,184 in home quarantine today, and 1,607 in total to date have gone through home quarantine. There have been 4 positive cases from the home quarantine cohort so far. The source cases were picked up in their first 7 days while in quarantine. This is important because it shows us that the first week of someone arriving in the territory is where the risk is, with only a very small risk of infectivity in the second week. We are very happy of how we are progressing through the steps towards our COVID-safe freedoms. But we know that the 20th of December is our biggest step so far. Today, we want to give what we hope will be the final details on how everything will work from the 20th of December when home quarantine ends. Who this applies to, what will be required of them, and why. We've been very clear that there will still be testing requirements and other rules for fully vaccinated arrivals after this date. You won't have to quarantine, but there are still rules and you have to keep getting tested. For anyone planning to come to the territory, please be left in no doubt. You'll still need to get COVID tests taken before you get here and after you arrive here. No one gets a free pass to the territory without us being as sure as we can that you won't spread COVID. In the past few days, our health, police and policy teams have been reviewing how the testing regime for people in home quarantine has been going, as well as the rollout of rapid antigen testing for some arrivals to inform our decision-making on the testing requirements from the 20th of December. Those decisions were made this morning. I will give you an overview now, then explain each of them in detail. From the 20th of December, we will stop making a distinction between red zones and green zones. Every part of Australia will be treated the same, and every fully vaccinated arrival to the territory will have the same simple rules to follow. Arrivals will be required to have evidence of a negative PCR test within 72 hours before arriving in the territory. Take a PCR test in the first 72 hours following their arrival in the territory, then take a third and final test on their 6th day in the territory. 3 tests, no more. There will be no home quarantine requirement for any fully vaccinated arrival to the territory, but arrivals will need to stay in a high vaccination zone for 14 days following their arrival. I'll talk through that more soon. Finally, the rules for unvaccinated travellers stay the same. Non-territory residents are banned from entering the territory, and returning territory residents will need to undertake 14 days of supervised quarantine at their own cost. Since we first closed the territory's borders in March last year, we've been declaring COVID-19 hotspots and restricting travel from those areas. Recently, they've been called red zones. This approach has recognised that while some parts of Australia presented a high risk to the territory, other parts of the country pose no threat and shouldn't be blocked from coming here. The whole country is now entering a phase of dealing with this pandemic, where the virus will gradually become endemic as we learn to live with COVID as a highly vaccinated society. We generally declare red zones wherever COVID has spread. At some point in the near future, that's going to be pretty much everywhere, making the need to declare red zones increasingly pointless. If we stick with the current approach, it's likely we'll just be adding more and more red zones by the day, making life more complicated and chaotic for people travelling here. Keeping the distinction between red zones and green zones also provides an incentive for dishonest people to mislead us about where they have been. And as we've learned the hard way, whenever there are loopholes, some people find a way to jump through them. We want to put an end to the on-again, off-again declaration of hotspots We will make this rule super simple so that everyone coming to the Territory knows exactly what is expected of them. And importantly, we want to make it easier for our frontline workers as well, who have not stopped working and are only going to get busier. They are all saints. We want to make their job easier, not harder. Having a simple system for them to implement and manage makes life a bit easier for them too. So from the 20th December, the key question on arrival won't be where you have come from, but whether you are fully vaccinated or not. That's what matters. As I said earlier, our team of experts have been reviewing how our current testing regime is operating to determine the most effective testing method when we remove home quarantine on the 20th. For a COVID testing system to be effective, it needs to achieve three things. It needs to be easy enough for people to comply with. It needs to be accurate so we know who is positive and who isn't. And it needs.
You're just listening there to the Northern Territory's Chief Minister, Michael Gunner, outlining some new rules for travellers inbound to the Northern Territory from the 20th of December, simplifying some of the rules that have been in place in recent months, and particularly during the latest outbreak, with 3 new cases being added to that outbreak in the Northern Territory today.